This is a one-board technique for a bent knee. The first provider will maintain stabilization. The second provider will assess circulation, motor, and sensory.
Pulse. All right, can you wiggle? All right.
If not already done so, they will expose the injury site. At this point, they would attempt to take the knee to a position of function, which is straight. They will stop if they hear or feel crepitus, meet resistance, or the patient complains of too much pain. Using a one-board technique, the board is dressed the same as it is for a bent elbow. You will use one padded board splint with 2 cravats over top. The padded board splint will come to the outside of the patient's leg. The provider holding stabilization will secure the board with their thumbs. The 2 cravats will go underneath the patient's knee. So the first cravat, you will take both tails, pull them directly across, come up, wrap them on either side of the board, and then tie them. You will not cross the cravat on the opposite side of the leg. This process will be repeated with the top cravat. You will take both tails, bring them up on either side of the board, and then tie a knot. You will then take one tail of the cravat, slide it through the loop, bring it back, tie it to the other tail of the cravat. At this point, you will reassess circulation, motor, and sensory.
Pull your toes away. And which toe? All right.
A one-board or a two-board method are both acceptable. Please note, if you are using the one-board method on a patient who has a lot of fatty tissue, that the cravats will dig into the fatty tissue and increase your patient's pain.